YNA is a podcast that focuses on mental health and other aspects relating to what goes on inside of a person's head. We are by no means professionals in this field and only aim to make these conversations about mental health easier for the listener. Nothing we say or talk about is professional advice unless explicitly mentioned. If you seek professional advice or experience symptoms of an actual mental disorder, please contact a professional or visit your closest center for behavioral health. You are not alone.
What's up, guys? Thanks for listening to today's episode. If you're looking for more of our content and merch information, be sure to check us out at ynamentalhealth.org. Keep an eye out for our skits and upcoming episode information. Feel free to reach out to us on IG. Our DMs are always open. And please remember, you're not alone.
Hello. Welcome back to YNA Mental Health. My name is Sina, and I'm here with Tareq, and we're on episode on medication part 2. So, welcome to the podcast. We really appreciate you coming out, kind of explaining your story and kind of getting an understanding of what medication is and kind of getting a background on who you are. So, if you could just explain a little bit about what you do and who you are, we'd really appreciate it.
Sure. Thanks for having me. I'm Tareq Yaqub. I'm a child and adolescent psychiatrist. So I work primarily in a hospital setting. So I see youth who are hospitalized psychiatrically for acute mental health issues. I also work on the step-down unit, which is called like a partial hospitalization program. That's you kind of go to programming and groups and stuff from like 9 in the morning to 3 in the afternoon. Usually people go for about 2 or 3 weeks. So medication is something I prescribe every day, but I'm also trained in something called psychodynamic psychotherapy, which is kind of what, if you've ever heard of Freud and psychoanalysis and stuff, it's kind of an extension of that. But one thing I really focus on is the symbolic meaning of medication.
Okay.
And so I think talking about medication is really important, just how we think about it, what it actually treats, what it actually does.
So, what got you into this field? It seems like for a lot of people these days, we get lost in our careers or we don't even know where to start. What got you here, and how did you even get into wanting to help people like this?
Like a painting right there, I haven't put up yet, but it's a Frantz Fanon who's like very famous. I mean, he started off as a psychiatrist, but he was born in Martinique, studied medicine in France, started thinking about racism a lot, moved to Algeria because Algeria was essentially like a settler colony of France at the time, was working in the prisons in Algeria and was treating people who were labeled mentally ill. But he was saying, the social conditions are, and the oppression's what's making people, it's mentally ill. Like if you're sane when you're being oppressed, that's actually insane. So he ended up kind of leaving that post and joining the Algerian army to fight against the French for liberation. So he's always been a hero of mine. I studied history in college. I was a history major, and I focused on kind of theory and post-colonial theory, and him and Edward Said were like the two giants of post-colonial theory. And I thought I was going to be a history PhD. I think when you're in academia like that, you make the things you actually are interested in don't make enough of a social impact, right?
Yes.
Right. So I thought medicine would be a vehicle for social change.
Yeah.
Because I was really involved in student activism. And so I went to medical school hoping to figure out a path for me, but Fanon was always my guy. And And I went to my psychiatry rotation. I ended up liking it the best because it was probably the least algorithmic part of medicine.
Okay.
A lot of medicine now is stepwise. Like if you're a cancer doc, not to knock on them, they do amazing work and stuff, right? But like a lot of it is protocol based.
Okay.
But in psychiatry, there's still like everyone's relationship to their brain and to their life is different, right?
Completely different.
Yeah. The brain is a subjective organ, right? Like the heart doesn't know it exists, right?
Exactly.
But the brain knows it exists, and so we still struggle to really make sense of that scientifically.
Yeah.
And so that's what drew me in.
Wow.
It was to still be theoretical and do the art of medicine, and but still try to have like a neuroscience basis for things.
So the brain really interested you, and you kind of just went down this path of like understanding not only who you are and what you need to deal with, but understanding how many people these days go through so many difficult, traumatic experiences compared to going through some kind of an abuse to going to anxiety and depression, like things like that. Um, what types of mental health conditions can be treated with medication? We could just dive deep in.
Yeah, I mean, mood disorders, so like
Mhm.
depression, bipolar disorder, things like that. Anxiety disorders, psychotic disorders,
Mhm.
schizophrenia, things like
Right.
that. Neurodevelopmental disorders,
Mhm.
so ADHD, for example. I mean, probably stimulants are probably the best medication, like the
Yeah.
most effective medications we have in psychiatry,
Yeah.
right? And I know it's kind of a polarizing topic about stimulants and stuff. And then I think some conditions have psychiatric sequelae or
Mhm.
symptoms, right? Like people with dementia may have irritability or aggression, or
Mhm.
some people with autism who are nonverbal, for example, and can't communicate their needs might have aggression and irritability. So there's medication specifically focused for that.
So it seems like with medications, they're all separated into whatever you're dealing with, whatever you're going through, and it's kind of prescribed to you as it goes with the level of on I believe it's on a spectrum if I'm correct. And with symptoms, they may indicate persistent feelings of sadness, anxiety, or hopelessness, difficult in sleeping, fatigue, or loss of energy. With these symptoms, one of my friends brought up a really good point was when do I know that I'm at a level of like this needs to be fixed or this needs to be changed? Because it seems like we're stuck in a world where I can feel irritated, but when do I know that I need the help to get the medication? Do you have any way of like trying to help someone like that on that kind of level?
Yeah. So although I prescribe medications every
Mhm.
day, I'm generally a minimalist with it. And a lot of times, especially because I work with kids being hospitalized,
Mhm.
a lot of what I do is take away medications.
Yeah.
But that being said, I think what the conversation I have with families and patients about medication is, hey, are these symptoms causing functional decline?
Okay.
So with kids, that means like were they like an A B student and now they're failing classes, or
Mhm.
are the symptoms getting in the way of friendships? You're losing all your friends somehow for whatever reason, or your job that you're working on the weekends, like you work at Starbucks or something,
Yeah.
and you're just not performing to the and you can't handle basic mundane tasks that you used to be able to do. So if you really notice like a downslide in your social functioning and your professional functioning,
Mhm.
that's when I suggest starting a medication.
How do you determine the right medication and dosage for a patient?
I mean, I think that's a great question because unlike other fields in medicine, right? Like if you have diabetes, we can take your A1C. We can, based on that number, there's a specific medication based on
Yeah.
potency that you can choose. We don't have tests like that in psychiatry. So it's a very symptom-based treatment. So what I say is medication doesn't usually treat an underlying
Mhm.
cause, right? It treats the symptom because we don't know truly what the underlying cause is from a neurobiologic level. I would say maybe people with PhDs and stuff in neuroscience have
Yeah.
have theories and they're trying to solidify them right
Yeah.
now. But so, if sleep is a big issue, I might give a medication that's not to help with sleep. If like energy is the biggest issue,
Mhm.
I might cater it to that.
Okay.
So it's usually what symptom do you want to change the most? Which one's the one limiting you the most? That's what we address.
And of course, with symptoms, there comes potential risks of side effects. And someone had pointed out to me that they had been gaining a lot of weight because they were on a certain type of medication and they wanted to come off of that medication and kind of switch and change. I think with that, it's kind of getting an understanding and self aware of like your body and seeing how the medication and you kind of go hand in hand. For people that are going through those kind of side effects, how do I deal with these kind of side effects on a daily basis? And when do I know I need to transition to a different one because it's just not working for me?
I mean, if the symptom's not improving, usually we say give these medications a month or two, right? If you're seeing zero change whatsoever, one, maybe the medication's not working, or two, maybe it wasn't a medication issue to start
Yeah.
with, right? Because sometimes I see, especially kids, and they're aggressive and they're irritable and they're on medications, but the real issue is like the relationship they may have with their parents, right?
Yeah.
Or the anxiety their parents have about their kid, and they're kind of just projecting it onto the kid. So they think he's like, or she's like this horrible person. And so we're just throwing meds at them. But if we were just able to have the parents think differently about the kid, maybe we wouldn't need it. But to answer your question more directly, if it's a medication issue that's just not working, I'd say wait a month or two. If there's no symptom improvement, then you should think about change. And then everyone should knows their bodies well,
Yeah.
right? And if you feel like there's side effects that are not tolerable, it's not worth being on the med.
Right.
Right? Like if you are feeling more irritable, if you can't sleep, if you can't eat, like you lose your appetite or something, or you're gaining a lot of weight in a way that is really making you feel bad about your body or not giving you the energy you have
Yeah.
or you want, then it's probably worth switching.
With coming to prescribing medication, of course, there comes instructions. And it seems like a lot of people these days, they kind of try to follow the instructions, but they also try to follow what their body's trying to tell them. If I'm prescribed a medication, do I take it as is, or do I try to focus more on what works? Like if I have a crazy exam and I'm on anxiety medication, if I continuously slow down on my medication, but when that exam comes up, I continuously take more, am I doing it right, or am I kind of going down the wrong path of like I need to follow instructions instead?
I think there's so many different types of medications. So, I mean, I think I better answer that question if it
Okay.
was specific. But in general, I think a lot of these medications either take time to build up or work right away. And so, in both cases, they should always be taken as prescribed. Because if they're the ones that usually you just take in the moment tend to be addictive, or you tend to build a tolerance to.
Right.
So if you take a lot,
Yeah.
or more so than you're prescribed, then they'll probably lose their efficacy over time. And the ones that take a while to build up in your system, take a couple weeks to fully work. If you just take a couple extra, they're probably not going to do much for you for symptom relief, but they might increase side effect risk in the moment.
When you try to separate these mood disorders on what medications to take, is there any that you follow? Like with anxiety, like with depression, you take Prozac as an antidepressant, if I'm correct on that. And is there with each one, is it completely different? Because I know anxiety and depression, they go hand in hand. So do you prescribe two medications for each one, or is it kind of just understanding like what is more of an effect on you, depression or anxiety?
Well, the medications that are first line for both depression and anxiety are in the same class. They're
Okay.
SSRIs, selective serotonin reuptake inhibitors. They're medications that increase the level of serotonin in your brain and then upregulate the receptors downstream later. And so, if someone has depression and anxiety, that's usually our first line med, and then you can kind of hopefully treat them with one medication. And there's a lot of studies. So how I choose the specific antidepressant for someone is they're all very similar, but they have little nuance differences.
Okay.
So one of them might be better at giving you a little bit more energy. So one of them might be a little bit more sedating. So if you can't sleep, it might be better. One of them can help maybe, stabilize appetite. So
Yeah.
it's really based on the symptoms you have, like these little differences. Some of them also are known to interact with drugs more than others or less. So if someone's on a lot of meds, I'll add one that, is not metabolized in the liver in the same way as some of their other meds. So that's kind of the nuances of it. I turn to a lot of studies. So in adolescents and youth, probably the most studied antidepressants, there's three of them. And I call them antidepressants because that's what they're called, but SSRIs, they're also anti-anxiety meds,
Okay.
are Prozac or fluoxetine is the generic name. Lexapro or escitalopram is the generic name, or Zoloft or sertraline is the generic name. So those are probably the three most studied in youth. So I like to use the big clinical trial studies.
Right.
And so I base a lot. I prescribe those the most just because they're the most well studied in youth. There's times where I use other ones, but working in an academic setting, I tend to rely more on the clinical studies.
Yeah, of course. And what you had said in our episode now is that it depends on what symptom you need to tackle first, whether it's sleep, whether it's eating, like what is it? And then it seems like from there you kind of get a better understanding, okay, which one do I go with to kind of help this person go through with whatever they're feeling. Adolescents these days, it feels like we're so confused, and some people go the medication route, some people go the therapy route. Do you recommend one or the other, or to go both ways? Is there some that you believe? Have you ever seen someone go through something and been like, hey, maybe medication isn't for you, maybe we should go down the therapy route instead for you? Is there anything you see like that?
Yeah, I mean, I do that a lot
Mm-hmm.
often. I think I see. So for someone to get to a point where they're psychiatrically hospitalized, there's usually, you know, intense suicidal ideation or even a suicide attempt, or there's a lot of aggression, or there is like uh, a difficulty being based in reality still, what we would call psychosis. Um, and so everyone kind of jumps to medication first at this level. And I think oftentimes medication is needed, but there are times, like I said before, like, hey, how did we get here? What's the story?
Mm-hmm.
Are we trying to fix something that medication can't fix? Like, trauma in the home, abuse, um, intense poverty, violence in the neighborhood.
Yeah.
Those things, like, yeah, they're gonna affect your mood a lot. But
Mm-hmm.
if I give you a medication to help quell symptoms, am I doing you a service or a disservice, right?
Right.
Because you should be feeling those things in situations like
Mm-hmm.
that, right? So that's always the question I ask. But when it comes to therapy and meds, if we're looking at like really severe anxiety or depression, the studies will show us that dual therapy, so therapy and medications, give you the best outcome in the fastest amount of time.
Okay.
So I like the big studies in youth. There's one called the TAD study, the Treatment of Adolescent Depression study.
Okay.
Will show you kind of what it showed us is that in the first 12 weeks of treatment, if you were on a medication and therapy,
Mm-hmm.
so if you did both together, you got better faster. It depends how severe the symptoms are. Like if the symptoms are so severe, like if I have to live 3 more months like this,
Yeah.
you probably want to do both.
Yeah. Is there any level, I feel with addiction, it comes to a point of getting lost in what is prescribed to you. And it feels like addiction is much easier these days than it was. Or maybe I'm completely wrong, or maybe addiction was easier back then than it is now because it feels more controlled on level of dosage. For someone who's worried about medication and feels like they might get addicted to something like this, is it possible to reframe your mindset to be ready to take the medication so that you understand, like, hey, maybe I need to be careful? Or is this some kind of conversation that needs to continuously be had with your psychiatrist?
There's different types of medications, and some of them your body will get physiologically dependent on
Mm-hmm.
and can potentially become addictive. And there's some that are not.
Mm-hmm.
Right. So in the first case, those are usually medications that we try to say don't take it every day. Space it
Okay.
out as much as you can. Only take it as needed.
Mm-hmm.
Where if you're taking, like, for example, you brought up Prozac earlier.
Yeah.
If you're taking Prozac and it helps you every day, there's this big debate on whether are depression and anxiety chronic things.
Yeah.
Are they cyclical? Like, do they come and they go? Do you only use them when they come every
Mm-hmm.
year or two when you have a really bad anxiety spell or
Yeah.
whatever? And I think there's different debates within psychiatry on are mood and anxiety disorders, are they always chronic? Are they always episodic? Or are they situational?
Okay.
So conventionally, what we do is, if someone has anxiety to the point where they have to be hospitalized, oftentimes they leave with a medication, say it's Prozac or Zoloft or something. And conventionally, we say take it for about 8 months to a year. if symptoms improve, we trial it off.
Okay.
In the first year, about 20 to 30% of people off medications will notice symptoms coming back.
Okay.
And then in about 3 years off medication, about half of people will notice symptoms come back. So I always tell families and patients, like, I don't know which 50% you're going to be in after you're off. You know, and we don't really have good markers to tell us who you'll be, but it's always worth trialing off.
With parents and guardians, as adolescents grow through some levels of nature and environment, like we were talking before this, how the pandemic has such a major impact on just not only our mental, physical, everything in our daily lives. We went through some huge part of history. With parents and guardians, it feels like sometimes these situations are kind of blown out of proportion, whether you did something and now your parents are kind of frustrated at you and they're like, you need to go on medication. How do I talk to my parents about needing medication for my mental illness when I need to realize, hey, I need the help rather than put them pushing me to get the help that I need?
Yeah. I mean, I think that's always worth an exploration with somebody who prescribes about what we believe a medication can do for us. Because there's times where parents are pressuring someone to get a med because they think, hey, there's something wrong with my kid. And our question is, what's actually wrong? Is it your child, or is there something disrupted in this relational matrix? We don't live in vacuums, right?
No.
And then the same thing, like every time someone comes to me and says, hey, I think I need a medication, hey, what do you think the medication's going to do? So I always say, like, if you want to talk to someone, like talk to a friend or a family member about being on a medication, the way to approach it is to say, this is what I'm hoping a medication will do, and this is because this is what I've tried and it hasn't worked. Like, I'm trying to sleep early, and I'm turning off all the lights, and I'm drinking sleepy time tea or whatever it is. And I still, like, my mind's racing. I can't sleep. I wake up. I have no energy. I even trying to exercise. It's not working. Like, if I could just slow these thoughts down at night or do that, I've tried everything already. This is why I think a medication will help. I think people are generally very understanding if you present it in that way. But I think when you come really vague, like, something's off and I need medications, like, sometimes people aren't as supportive. You know? So I always think, like, I think you're kind of getting is communication is the most important thing, and specificity in the communication is important. So if you're someone that wants to explore it and you want your friends or your family members to help you, I would say, like, this is the specific thing that I've already tried non-medication rounds and it's not working.
We're trying to break the mental health stigma these days because it feels sometimes like there's this massive rock around people or this boulder around their ankles, just trying to be like, I take this medication because I deal with a mental illness and I'm trying to better myself. And just having that self-awareness is what we try to push on the podcast, is because if you understand yourself, understand the feelings that you're going through, you can understand how to kind of get a grasp on your life. As a parent, though, when do I decide that my child needs medication? How do I even have this conversation without my child getting, like, defensive? Have you had any kind of experience where you had to talk to the parent to be like, hey, listen, your child does need this? Is there anything that you went through personally?
Yeah, I mean, I think this happens almost every day with me. Either the child wants to be on a medication and the parent doesn't want them to, or the other way around. The parent's like, hey, I think you should really take this. And again, it's about taking a step back and looking at what are we specifically trying to address and how do we communicate about it better. And I do a lot of times I do a lot of family work around not just medications, but symptoms and family life and things like that. And the key is to see that, everybody has to make a compromise, right? I think a lot of times if a child feels like a parent's forcing them to take a medication, they probably feel like they don't have a say in their life outside of just the medication thing, right? So it's about, like, hey, it's not just about the medication here. Sometimes it is. Sometimes it's like, hey, yeah, it helped me, but the side effects were horrible. Can I try something else? And that's something I can help them with too, right? But sometimes it's like, my mom and dad don't let me see friends. They don't let me do anything. I stay at home. They're so worried about me all the time. And now they want me to take a medication I don't want to take.
Right.
And so we take the more global picture where it's not really, is it really about the medication or is it about something else? So I try to explore first, like, what's the reason for not wanting to, for pushing it from patient or family or not wanting it, right? Is it symptom? Is it side effects that happened? Is it, someone else had really bad side effects? Is it like a lot of times people feel like medication's a crutch, right?
Right.
And that's a discussion I have a lot. Like I think it's a tool, just like with anything else, right? Like you see me, there's like a protein shake thing here.
Yeah.
Like, it's a tool, right?
Yeah.
Like, do I absolutely need it to optimize my workout? No. But like, does it help? Sure.
Yeah.
And so that's kind of how I view medications. They don't really treat an underlying cause, but they help with symptoms. And if you're in a state where you're really struggling, they're a helpful tool to use.
Now, fear is what I keep getting told by a lot of people who have come and talked about wanting to take medication. Feels like it's a cliff, and then the second they jump off the cliff, it's just a free dive, and they are so scared of what's going to happen next. Do you have any words of encouragement for somebody who's looking down the cliff, and it could just be a shallow pool of water that you just need to hop into rather than this massive thing that we blow up in our minds? Do you have anything that you could help somebody who's on the border? They just aren't sure whether they should do the medication or not.
I mean, I say, it's always your choice, right? And just because you start one doesn't mean you have to commit to it forever. I know there's a lot of, it feels like this sense of pressure that, okay, if I start it, then I'm committing to it. And, the doctor expects me to take it. I don't want to let them down or whatever it is. But that's, at the end of the day, it's your body and your choice. So I always say, like, hey, I always go over all this, like all the common side effects and say, you're at a point where you're thinking about it already. It's not like it's a point of no return.
Yeah.
You take it. I'm here. We can check up whenever. I usually, when I was working more outpatient and dependent on the severity of symptoms, but if we made a med change, I would check up on somebody anywhere between a week and a couple months after. And you usually have access to your doctors through some sort of my chart messaging nowadays. So I always say, like, if you notice anything that feels wonky at all, just my chart message me.
Okay.
We'll get back to you as soon as I can.
Nice.
So again, it's not a commitment forever. It's not like a surgical procedure or a tattoo. It's not permanent.
Yeah. And for our listeners, remember that these are things that you decide. It is your choice in the end, and it isn't. And I think that's one of the hardest things that people can't seem to grasp is, like, they feel like it's going to be forever, that I'm going to take these pills forever and that nothing is going to be fixed. But as you're saying, you're completely right. It is truly a correction of when you're starting to feel better in yourself. How can someone who is trying to help others, how do I help them navigate the mental health care system and find the right resources and support to be given to them?
Yeah. I mean, that's a great question because unfortunately our system here is really fragmented. I think it's important to know the different levels of care. So there's therapy, there's seeing a psychiatrist for medication management. But if you're having an acute crisis, like if you're having a super bad panic attack or you're really thinking about harming yourself, or maybe you already harmed yourself, but you need help right away, that's when you go to the emergency room. And from the emergency room, you can be directed to an inpatient where you're hospitalized, or kind of like these intensive outpatient or partial hospitalization programs. So an intensive outpatient program is usually about a month, and it's usually 3 times a week. And you do some group work, some individual work. It's usually happening in the evening, so people can go after work or after school. Where a partial hospitalization is usually 5 days a week, and it's 9 to 3, like a day treatment program. So I think starting with the levels of care and knowing, like, just thinking about which one might be most helpful to you is a good place to start. Unfortunately, a lot of mental health care reimbursement is not on par with other medical specialties. So a lot of really good therapists and psychiatrists, unfortunately, like don't take insurance,
Yeah.
especially in a city like this where there's a lot of wealth.
Right.
And that's kind of just a tragedy of our fragmented system. Oftentimes, like if you have Medicaid or Medicare as your primary insurer, you can have access to what are called community mental health centers. So the best way to find them is to Google like your county and say community mental health. And
Okay.
sometimes there's resources there too.
Nice. Thank you for sharing the resources. I know there's going to be a lot of people who are wondering what's the next step? Where do I go from here? Now that I want to take medication, how do I find the right direction?
And you can always also call the number on the back of your insurance card and see
Yeah.
which providers are in network, and they might tell you they should tell you who's still taking patients and who's not.
Nice. I feel like now in our day and age with social media, and you probably have seen this a lot, where we've begun to self-diagnose. Like the second something's wrong with us, we go to www.webmd.com, and next thing you know, you feel like you're dying, and this amount of overwhelming pressure feels like on top of you. Do you believe nowadays that are we in the position of that self-diagnosis is good, that maybe they get a better understanding of what they're dealing with, or do you see it becoming more of an issue down the road when someone's freaking out in front of you and like, I have this worse anxiety and I don't know what to do?
Yeah, I think especially with mental health, like the diagnoses in psychiatry and psychology and the DSM, which is the Diagnostic Manual for Mental
Right.
Illness, is the diagnosis is a descriptor of symptoms, right? It doesn't really correlate to anything it doesn't have a neurobiologic correlate, for
Yeah.
example. So like it's different in that regard because it's not very specific, right? It's not an exact thing. This diagnosis is not corresponding with an underlying illness. And what I always like to say, and this is borrowing from a psychologist in Colorado, he used to be a Colorado, named Jonathan Shedler. He says, a diagnosis is not a disease, right?
Yeah.
And I think there's real trouble when this mental health diagnosis becomes to signify some underlying disease, right? Because that's shifting your understanding of self, of there's something intrinsically or biologically wrong with me.
Right.
Where there's no doubt there's biological components of it, right? But there's also things that are still in your ability to help to overcome with or without medication. And the diagnosis is not your identity. It's not how you relate to other people. It is a descriptor of the symptoms you have. And so if someone comes to me and say, I think I have this, I'll say, well, these are the symptoms you're saying you have. Which symptom is the most functionally impairing and how do we address it? For me, it's less about the underlying diagnosis and more so, can you still have a healthy relationship with yourself? And obviously you're looking for a diagnosis because you're trying to understand what's going on with you internally. So let's do that together, right?
Nice.
Let's find out something's off. The diagnosis doesn't really give us a full explanation, right? The diagnosis here is just a description of a symptom cluster. That's not specific to only you. And what you're going through is specific to you. So let's figure out what else is going on inside.
I think that's the quote of the podcast episode. Your diagnosis is not your identity. I really like that. That kind of really stuck with me because it is true. Like it's not who you are. It's just a spectrum of what you're dealing with, and that the spectrum doesn't know the environment that you're in, the amount of like all of the things that go on in your daily life. It's just supposed to help you, kind of push you in the direction of getting the help that you need. So we're coming to the end, and I think our final question is I'm somebody who struggles with a lot of different mental health issues, and I'm trying to get people to understand how to get a grasp of that, whatever they're dealing with, that they aren't alone in these days. Do you have any words of encouragement for anybody who's going through whatever they're dealing with in their mental health issues these days?
Yeah, I mean, I think the most important thing is find people you can be open. People that you feel comfortable opening up to. That, we all, if you can have a good supportive group of friends or family members that can really help you just talk about some things. And also, like, having a good relationship with a therapist is also very helpful, like, kind of just always being introspective and reflective. I think the important thing is sometimes we get so bogged down by our daily lives. Um, is when I used to see a lot of graduate students as patients, what I used to do is, instead of scheduling the studying and all this stuff first, we would schedule all the fun leisure stuff first. Because what happens is people procrastinate studying, they do that, and then they miss out on all the fun stuff. So we always put, like, no matter what, you're gonna go to this party or watch this TV show or whatever it may be. So to make sure you're always doing things, even when it's hard to get the energy to do them, to do things that bring you joy as much as you can. So I think the two big things is social connection is important, and don't lose your hobbies, because it's very easy to get bogged down by depression, by anxiety, by social pressures, by work, to stop doing the things you like.
And that's a great point, because truly doing the things you love will bring you so much joy and so much happiness that a lot of other things won't. So all I want to remind you guys, and again, thank you, Tareq, for coming on, explaining a lot about medication, and truly kind of changed my perspective of how I think about it. And we hope that we changed your perspective. We just want to remind you that please, please, please remember that you are not alone, and that we will catch you on the next episode. Thanks again for coming on, and we hope to see you on more future episodes from now here.
Thank you so much for having me. I appreciate it.